In this lecture, we are going to review the topic of sexuality and disability. It is commonly believed that a person in a wheelchair is sexless. People with physical disabilities are thought not to be interested in sex, much less to be capable of engaging in sexual activity. Contrasts those stereotypes with the following ideas from one woman with a spinal cord injury. And I quote, "Don't think paralysis takes away your womanhood because you don't feel sex anymore. It doesn't. First of all, you're a woman, you're pretty, and you're able." The point is to have the self-confidence to realize that you haven't changed so much other than your paralysis. Now, ableism refers to discrimination or oppression of disabled people, which may include denial of rights and the perpetuation of stigma. About 10% of adults in the United States have a physical disability that imposes a substantial limitation on their activities. Given a chance to express themselves, these people emphasize the importance of their sexuality and their sex drive, which are not necessarily altered by their disability. Yet they must face sexual ableism, which assumes that there are qualifications that one must meet to be sexual, based on criteria such as ability, intellect, appearance, and age. Space does not permit a complete discussion of all types of disabilities and their consequences for sexuality. Instead, we will concentrate on two illustrative examples: spinal cord injury and intellectual disability. Let's focus now on spinal cord injury, which usually is the paralysis of the lower half of the body on both sides. Many able-bodied people find it difficult to understand what it feels like to be paralyzed. Imagine that your genitals and the region around them have lost all sensation. You would not know that they were being touched unless you saw it happen. Furthermore, there could be a loss of bladder and bowel control, which may produce embarrassing problems if sexual activity is attempted. The capacity of a man with a spinal cord injury to have an erection depends on the level of the spinal cord at which the injury occurred and whether the spinal cord was completely or only partially severed. Now, according to most studies, a majority of men with a spinal cord injury are able to have erections. In some cases, only reflex erections are possible. In other words, erections are produced by direct stimulation of the genitals, even though the man may not be able to feel the sensation. Injuries in the lower sacral portion of the spinal cord can have especially serious effects if they injure the erection reflex center. Physicians are experimenting with surgeries that would restore sensation to the glans penis in these cases. Now, In a few cases, particularly if the injury was not severe, the man can produce an erection by erotic thoughts, but more typically this capacity is lost with spinal cord injury. When the injury is severe, the man cannot ejaculate, although ejaculation may be possible if the cord was only partially severed. Now, women with a spinal cord injury experience many of the same sexual responses as other women, including engorgement of the clitoris and also erection of the nipples and increases in heart rate. Approximately 50% of women with spinal cord injuries can have orgasms from stimulation of the genitals. Some women with a spinal cord injury develop a capacity for orgasm from stimulation of the breasts or lips. Nonetheless, many other women with spinal cord injuries experience problems with desire, arousal, and orgasm. Because sexuality in our culture is so orgasm-oriented, orgasm problems among people with spinal cord injury may appear to be devastating. But many of them report that they have been able to cultivate a kind of psychological orgasm that is as satisfying as the physical one. Fantasy is one form of sexual expression that their injury does not stop. For women with spinal cord injuries whose menstrual cycling returns, their ability to conceive a baby is normal. Therefore, they need access to contraception if they wish not to have a baby. Most pregnancies proceed normally, although there is a higher risk of some complications. Vaginal deliveries are usually possible and can be done without anesthesia. It is important that sex therapy be available to people with physical disabilities. When working with people with physical disabilities, the therapist must assess factors such as the individual's mobility and level of pain when engaging in sex. Disability affirmative therapy is being developed and holds much promise for the future. Now, let's move on to intellectual disability. The DSM-5 uses the term intellectual disability or intellectual development disorder for what was formerly called mental retardation. To be diagnosed as having an intellectual disability, the individual must display 1. Difficulties in intellectual functions such as reasoning, judgment, and academic learning. This is determined in part by intelligence testing. 2. Difficulties in activities of daily living, which deficits such as communication, social participation, and independent living. And 3, the onset of these difficulties in childhood. Intellectual disabilities vary considerably from mild to moderate to severe to profound. These variation is reflected reflected in the spectrum of functioning of those with intellectual disabilities, from those who require institutionalization to others who function well in the community, who can read and write and hold simple jobs. 4 issues are especially important when considering the sexuality of persons with intellectual disabilities: their opportunity for sexual expression, the need for sexual education, the importance of contraception, and the possibility of sexual abuse. People with intellectual disabilities have several desires and seek to express them, despite the fact that they are often viewed by others as asexual. Because children with intellectual disabilities are often slower to learn the norms of society, they may express themselves sexually in ways that offend other people, such as masturbating in public. For this reason and others, better sexuality education for persons with intellectual disabilities is essential. It is important that people with intellectual disabilities be educated about contraception and that contraceptions be made available to them. Because they have typical sexual desires, they may engage in sexual intercourse. In one study, 24% of boys and 8% of girls with intellectual disabilities had engaged in intercourse by age 16. If these youth lack sexuality education, they may not realize that pregnancy can result. An unwanted pregnancy for a woman or couple with intellectual disabilities may be a difficult situation. They may be able to function well with taking care of themselves, but not with the added burden of a baby. On the other hand, some persons with intellectual disabilities do function sufficiently well to care for a child. The important thing is that they make as educated a decision as possible. Many experts recommend the IUD for women with intellectual disabilities because it does not require memory or forethought for effective usage. The topic of contraception and individuals with intellectual disability raises the ugly issue of involuntary sterilization. Until the mid-1950s, persons with mental retardation, as they were called then, who lived in institutions were routinely sterilized, although certainly not with their informed consent. We now view this as a terrible violation of the rights of these persons. It is now very difficult to gain legal permission to sterilize a person with an intellectual disability. A final concern is that persons with intellectual disabilities may be particularly vulnerable to sexual abuse. Because there is such a spectrum of ability among these persons, it raises the question of what level of intellectual ability is required for consent. So, in summary, there are 3 general points to be made about sexuality and persons with physical or intellectual disabilities. 1. They generally do have sexual needs and desires. 2. They are often capable of sexual response quite similar to that of able-bodied people of average intelligence. And 3, there is a real need for more information and communication about what people with various disabilities can and cannot do sexually.